I am so frustrated at the tax that we're not talking about ahead of Rachel Reeves's budget on the 26th of November. Hi, my name's Kat. I'm the director of We Own It, and on this channel we talk about why public services should work for people, not profit, and how we can win campaigns to take them back. So there's so much talk about tax right now and what taxes Rachel Reeves should deliver or not deliver. But there's one tax that no one is talking about. And if you look at the definition of tax, you have to change one word to see what this tax is. So a compulsory contribution levied by the government on workers' income and business profits or added to the cost of some goods, services and transactions. Normally, the compulsory contribution that you make is to state revenue. But what people aren't seeing is that actually the contribution that you are being forced to make is to private profits. And if we took that money back, we would save so much money that could go into public services and that could go into your pockets. So I'm going to argue in this video that we need to start talking about a privatisation tax. And there are 3 ways that you are paying that tax. Number 1, you're paying it through your bills. Every time you spend money on your water bill, if you are in England and you have a privatised water company, you are spending 1/3 of your water bill on the debt and the dividends of that private company. No choice, absolutely compulsory, and the impact that this is having on people is devastating. You are also spending around 1/4 of your energy bill on the pre-tax profits of the privatised energy companies. That's all money that isn't in your pockets, that you're therefore not spending in the economy. It's just a waste. But we're not talking about it, these huge chunks of money that could be going back into your pockets, back into the economy, and back into public services. Number 2, you're paying the privatisation tax through your council. So 70% of local authority funding goes to provide care for older people, vulnerable younger people, and so on. And at the moment, the vast majority of those care services are provided through private profit-making companies. And so many of those are owned by private equity and tax havens. A new report came out this week called Ending Extraction in the Care System. And it's absolutely shocking. And it shows that 250 million has gone out in profits in the last 3 years. And 1/3 of the money that goes out goes to those private equity firms and tax havens. So you spend money on your council tax and the money goes to the Bahamas. It doesn't have to be that way. It's crazy. The 3rd way that you are paying for the privatisation tax is through government spending on infrastructure. Because the government seems to have this idea that they can only invest if they involve the private sector, they are wasting vast sums of money that could be used to improve your services or put money back into your pockets. So what we're seeing, for example, with PFI, Private Finance Initiative deals that were agreed under Tony Blair, is that hospital trusts are still paying for them. Essex, for example, is having to spend 27 times over for its hospital because this deal was such a rip-off. The Conservatives in 2018 realised that private finance initiatives are poor value for money, and they said they wouldn't be using them again. And yet this government is looking at reintroducing failed PFI, failed private finance initiative deals, potentially repackaging them up with a different name, but it's the same old nonsense. It's the same old rip-off. And that is the 3rd way that you're paying the privatisation tax. And what it means in practice is that you don't get seen for your operation, or you don't get the service that you need at your local hospital because that hospital is spending more than they spend on medicines on their debts that they didn't need to have because the money could have been just funded directly. If you think it's outrageous that hospitals are being forced to pay back debts that should be really renegotiated by central government instead of focusing on patients, join our protest this coming Tuesday, the 18th. We're going to be outside the Department of Health at 1 o'clock. And we're going to be handing in our petition, and you can sign the petition in the link below. PFI sounds boring, but it's really, really important because it's effectively like the NHS taking out a payday loan when it could just fund services and fund buildings directly. If you think that the privatisation tax is one that Rachel Reeves should get rid of in the upcoming budget, please like this video, subscribe, and let me know what you think in the comments below. Thank you.